So, good morning, good afternoon, good evening, whenever you happen to be watching this. My name is Sharon Whiteman, and I'm the president of the Lyme Disease Association of Australia and part of a greater team that's working to build knowledge, data, education about ticks and tick-borne diseases in Australia. And today we're very privileged to be talking about a pre-launch and an early messaging around our Tick Science Alliance. And we're really delighted to be joined today by Dr. Mackenzie Kwak. He's a tick expert and a disease ecologist to discuss the early pre-launch of Tick Science Alliance. Dr. Mackenzie Kwak is a parasitologist based at Hokkaido University in Japan, where he studies ticks, fleas, and mites, among other eco-parasites. That just makes my skin crawl, Mackenzie. He co-chairs the IUCN Parasite Specialist Group. His research centers on the interplay between global changes, parasites, pathogens, their hosts, and environments, aiming to elucidate phenomena including co-extinctions, co-invasions, and zoonotic disease spillover. So I'm looking forward to learning more in the plain English version of that, Dr. Kwak. Thank you very much. I'm at the LDA, we're so grateful for the collaboration with you. We're really hopeful for progressing knowledge in Australia for current people who've been affected by ticks and future people, and also just the science, the knowledge base needs to be extended. So first, tell us a little bit about your background and how you became to be studying ticks, and particularly in Australia.
Okay, thank you very much for having me, by the way. So my journey began as I guess, a small child. Many small children are drawn to nature and things, and so I was always bringing home creepy crawlies and invertebrates and turtles and things like that. And then once I got to university, I realized that I was probably going to study invertebrates. They were very interesting and very diverse, and they're much easier to study than tracking rhinos or dingoes or something like that. And very quickly, I figured that I probably wanted to study invertebrates of medical importance. And so naturally, I was drawn to ticks and mosquitoes and lice and fleas and things like that. Um, and so I completed a Bachelor's of Science with honors from the University of Melbourne, um, and continued working on Australian ticks and fleas and other things for several years before eventually relocating to Singapore to do a PhD on tropical ticks and tick-borne diseases in Southeast Asia, and then finally migrated my way up to Japan. So I'm slowly moving north, half decade by half decade. In terms of Australian stuff, though, a lot of it was on marsupial ticks. And so some of that included finding new species like Isodes heathi, which is a really basically critically endangered alpine tick. We don't normally think of ticks as being imperiled, but this one is. To our knowledge, it lives in very high altitudes, and it often uses high elevation animals like mountain pygmy possums as their host. But then, of course, we've also done other work on more widespread and more important ticks like the paralysis ticks. And so we did the first kind of family, or first big family tree of that group of ticks to try and figure out how many of them were related. And since then, we've done things looking at the interactions between ticks and native Australian wildlife, particularly marsupials, things like that. Yeah.
That's awesome. And it's like it's not my background is in ICU nursing, so I don't have any interest in that, but I'm so curious and inspired by people that find something that just pulls them in and they do such a good job of it. So what's your contributions to tick research to date? How could you give us an
Oh,
overview of, because I know I've
okay.
the paper list, the list of
Sure,
papers.
sure, sure. You can go and read the paper list, which is probably very long and very boring for many people. Um, Broadly, I guess my attempted contributions, let's say, are kind of threefold. The first is that I'm very interested in uh, kind of biodiversity censuses. So I want to know what species are where. So the whole reason of, I mean, we've done stuff in Australia and found new species and things like that, but the whole reason I went to Singapore was because it was totally unstudied. It was this highly developed country with this massive economy, considering it's only 5, 6 million people now. And it's this tiny little area the size of the Melbourne, kind of greater Melbourne area, this whole country. And nobody knew anything about the ticks. So the effort was to basically go there and try and figure out all the species that are in that place. And so I've also tried to do that in Australia of trying to figure out what species are there. And that's the little, very humble contribution I've made with, say, Isotes heathi. In Singapore, it was a slightly more uh, large contribution because nobody knew anything. So any new knowledge is quite significant. And then, of course, we're doing the same thing here in Japan, and we're finding new species and trying to figure out which species are where. And that's quite important. So the first thing is, where are our species within both a national level, so countries like Japan or Singapore or Australia, but also then within that country, what states or local districts do we find these species? And if we have some idea of where our species occur, then we have sort of a head start on figuring out what diseases they may bring into human populations. And this can be infectious diseases, things like spotted fever, rickettsia, but it can also be non-infectious diseases. So these are things like mammalian meat allergy, the so-called alpha-gal syndrome, which was actually discovered by an Australian researcher, Cheryl Van Noonen, up in New South Wales. So the first is to understand where species are. My next aim is to understand who they're interacting with. I'm very, very interested in this kind of emerging field that we call network ecology. And this is the kind of focus on mapping interactions amongst entire communities of organisms, whole ecosystems, and trying to figure out who is interacting with who and which species are reliant on which other species. And this is very important with ticks because, of course, they're parasites, so they rely on host species. So by understanding who they're interacting with, we can figure out which organisms, which host animals, we may want to, one, screen for pathogens if we're looking for new pathogens that might spill out into humans, or if we have pathogens we already know about which exist in the system and we want to find out what their source is. And two, we also want to be able to understand which animals host animals we may want to undertake control measures for if we want to control tick populations. And that doesn't mean necessarily eradication. In some cases, that could be eradication, and that could be something like wild pigs, which we know in, say, Australia are not native and cause tremendous ecological damage, but also act as reservoirs of some important tick species. But it can also be things like a caricidal baiting. So this is where we actually give treats to some of these host animals laced with anti-tick chemicals so that we can preserve the wildlife species while reducing the abundance of ticks in a particular area. And we may not do this across the whole of Australia, but you may do this in, say, urban parks for something like bandicoots, where you want to drop the number of paralysis ticks cycling within your small area where children or families may be operating. So one is to figure out what species are present. Second is to figure out who's interacting with who. The third interest that I have is to try and understand how uh, natural phenomena impact the abundance of ticks. And so this can be things like understanding their phenology. So this is their seasonal cycles of abundance. But it can also be trying to understand natural triggers for tick outbreaks kind of thing. So certainly in the Northern Hemisphere, we have some ecological phenomena which precede and predict outbreaks of tick-borne diseases or outbreaks of ticks themselves. And so that's kind of the core. So who are our actors? Who are the ticks that are in the play? How are the players interacting with each other? Who's feeding on who relies on who? And finally, what triggers our series of players to interact or behave in certain ways? So we want to know what species are there, how they're interacting, and what's going to trigger disease outbreaks.
It must be unique country to country. I imagine it's be
Definitely. Yeah, yeah.
quite
The
novel
ecology of
outcomes.
like tropical kind of monsoon Singapore is very different to temperate snow-covered Hokkaido, which is also very different, of course, to Mediterranean Melbourne.
Yeah, no, that's amazing. And from your perspective and your past experience, what's the current state of tick identification and data collection in Australia specifically? Like, would you call it comprehensive or incomplete?
No,
And
no.
what's our understanding?
It's the dichotomy between what's done for mosquitoes and what's done for ticks is shockingly stark,
Mm,
let's say. So in most to give you some perspective on what ticks could be and what it's not, in most states, most state governments So these are either your state health department or your agriculture department, or sometimes both, undertake mosquito monitoring. And so they set out hundreds of mosquito traps across the state, and they're constantly identifying what mosquitoes they're getting in their traps and screening for particularly viruses. So we're thinking of things like flaviviruses and things like that. So these kind of mosquito-borne viruses, Ross River fever, mosquito-borne encephalitis, dengue if you're up north, this kind of stuff. So there's quite comprehensive surveillance and diagnostics for many of these mosquitoes. There are still some mosquitoes to describe and name. Australia is a very, very biodiverse continent with like like Africa, with this gigantic continent with this huge biodiversity, and a lot of it's very poorly studied because humans haven't been here. Like modern
Comparatively,
modern
yeah.
scientists undertaking taxonomy have not been here for a very long time. Whereas if you look at Europe, they've been doing taxonomy for 200-300 years. So they've got very little biodiversity. So there's a lot of people and a lot of time to figure out what species are there. Modern taxonomy in Australia has not been going very long. And so, say, the beginning of the 20th century is when it really starts to properly get going for things like mosquitoes and ticks.
Mhm.
So we've had a very short time to be putting names to faces in terms of describing species. So that's one thing. So the mosquito programs are very, very sophisticated. Ticks are almost entirely ignored by most health departments. In some places, you can understand that. So in somewhere like Melbourne, ticks are not actually zoonotic ticks, the species that will bite humans, are not actually very common. If you go up into the Dandenong Ranges or something, yes, you probably get ticks, or you go down into the Otways or down into uh, Lakes Entrance area and Gippsland, yeah, you'll get ticks. But around Melbourne, there are not actually that many ticks. It's quite dry. Uh, there's not that many. If you go into somewhere like Sydney, though, it's very, very ticky, or Brisbane, it's full of ticks. But still, these places don't have very sophisticated surveillance and monitoring programs the way they do for mosquitoes. And a lot of this is because a lot of tick-borne infections are very poorly understood. The epidemiology is not well studied, and we're still in the process of discovering lots and lots and lots of new pathogens. Um, so I would say that, at least compared to mosquitoes, Australian tick surveillance and tick-borne pathogen monitoring is very, very poor, and it's in its infancy. So there's huge scope to make very big and meaningful contributions um, in that space, I believe.
Mm. And that would positively affect so many people. So what personally drives you to continue and pursue this work? And what's your vision for the future of tick science in Australia?
I mean, at a core level, which is probably kind of selfish, I actually just like ticks. They're interesting. They're very ecologically diverse. They do all sorts of fascinating things. So from a scientific perspective, they're a great organism to be studying. Um, Secondly, my hope is that eventually we get to a point where we're treating disease, hopefully as accurately or more accurately, disease prediction, the way we treat weather. So
Mm.
we can have a prediction of whether we think it's going to be a wet year or a dry year. We can have some idea of whether the next month is going to be very hot or snowy or something like that. And I think eventually we're going to get to a point where we have sufficient data and sufficiently good models and things and good knowledge of how these species operate within the ecosystem that we can get to a point where we're basically predicting disease the way we predict weather. And in the same way that we prepare for bad weather, we should be able to prepare for times when disease outbreaks may be very likely. And through that, we can actually protect people. So that's my hope, is that eventually we treat
Preventative.
disease a bit like any other natural phenomena, like weather, and that we predict, understand it, and control it to keep people safe.
Mm. Wouldn't it be nice to be able to prevent some of the tick sickness that, that we're seeing not only nationally but globally? It's a very
Absolutely.
has significant impact. And what are some of the biggest challenges, do you think, that are facing people doing your work in regards to ticks and all around the
Data
globe?
collection. Data
Yeah.
collection is very hard.
Okay.
So the old days, so these are people like one of Australia's kind of tick founding father, Roberts. He could do a lot of things. He could do tick identification and description. He had a keen understanding of tick ecology. He also could do disease things, so pathogen isolation and things like this. That generation of people is gone. There are lots of specialists, and many of them are not necessarily very good at talking to each other, and many of them are not very good at doing all the steps in the process. So there's a huge number of modelers that, well, not a huge number, but there is a number of modelers that never leave their offices. They've never picked up a tick. They've never held a tick. They can't identify a tick. They don't know anything about its ecology, but they're very happy to go through other people's research papers or go through museum specimens and collect a whole bunch of data and then feed it into a model and spit out a map. And many of these maps are quite rubbish because these people have never met the ticks the animals that they're actually modeling. They've never been in the ecosystem. They've never pulled them off their host animals. They have no idea about the intricacies of what they're doing in the wild. That's a big problem because people spit out maps and other people assume they're kind of gospel, when actually any specialist that actually spends times with ticks in the wild can look at the maps and say, that's wrong, that's wrong, that's wrong, that's wrong. This is overestimating or underestimating. So that's a big problem. We have this disconnect of lots of people with lots of different skills and very few people with all the skills. I wouldn't say I have all the skills. In terms of pathogen stuff, I have other people in this lab that do the pathogen stuff for me because I'd rather be out in the field collecting and describing species or mapping phenological cycles and things. We all have our kind of special interests. But a big thing I would say is that one, abilities are very fragmented. There are very few all-round good experts. That's one problem. A second problem is data collection. In a place like Australia, it's a gigantic continent. Like I said, it's like Africa. It's this gigantic place. So going across and collecting distribution data for ticks is really hard. Fuel is not cheap. So driving across even, say, Central Australia, looking at desert ticks, which many of them do bite humans and cause some really serious, nasty diseases. So they're important too, even though the human population is small there. But I mean, you can drive for days and days and days, and you go 200, 300, 400 kilometers, maybe if you're lucky. And that's a tiny fragment of outback Australia. And even if you're going through, say, east coast of Australia or around the coastline, it's hard to collect really, really good data. It's very opportunistic. So a big problem is data collection and having large collections of data across the continent, and especially in places where people live, because humans basically live around the edge of Australia, and that's a very large area to try and cover with extensive sampling. So I think we have a real problem of data availability and data collection for Australian ticks. That's also made worse by the fact that there are very few people that can actually accurately identify ticks. Like I said, most of the people doing modeling can't identify ticks. They're totally incapable of it. There's a small number of people that actually can. So collecting specimens is one thing, putting names to faces is the next challenge. And if you do it inaccurately, your models or your forecasts are going to be inaccurate as well. So that's a real big challenge.
Mm. It's be an important mission within an industry or profession or a specialty to be able to make a difference in those kind of gaps. Or like in science,
That's
we can
why I picked Singapore instead of
yeah,
Australia.
because
Because
it's
Singapore's a
smaller
tiny area. You can walk from one end of the country to the other if you really put your mind to it.
and be
And
sure you
so
got a good
building
job.
a map of all the ticks of Singapore is easy. You can do it as one person, which I did in 4 years.
Yeah.
Doing Australia, you could spend a lifetime.
Mm. And I think in science and medicine, my background is more in healthcare, but when we don't know, sometimes we just make it up in the short term, and that's what gets published. And so, as science progresses, that's what we need to do is be willing to re-examine and relook at things so that we question still science. That's the very nature. The bottom line of good science is to continually question and
Yeah,
improve
yeah.
on
If
what
you
is
just
known.
if you accept dogma, then science stops and you become a religion. So you must always question yourself and others
Yeah,
constantly.
yeah. That's exciting to hear, Mackenzie. So, and this initiative that is about to be launched and has been developing over the last couple of years, the Tick Science Alliance, help the people listening today to understand what it is, why this sort of collaborative citizen-driven approach is so important for improving tick data in Australia.
Hmm. So, as I mentioned previously, going around the whole continent, intricately sampling every little habitat for ticks is a non-starter. It's almost impossible. However, in, say, the 21st century, we've had this real rise of so-called citizen science, and this is everyday people getting involved in scientific research and doing a little bit of it, and collectively, through the work of everyone, we can understand very big, complicated systems with these armies of citizen science, everyone individually doing their small part to build a bigger picture, basically.
Mm.
And uh, Australians are spread all over the continent and they have very, very different habitats. So what may be happening in Sydney is very different from what's happening in North Queensland or what's happening in outback South Australia. The ticks are there though, they're biting people, and many of them are making people sick. The situation is different across all these areas. So there's not a one size fits all. We can understand paralysis ticks around the Sydney North Shore till the cows come home. But it's not
Yeah.
actually going to help someone in outback South Australia. It's not going to help someone in Western Tasmania that's dealing with potentially different tick species and different infections or different non-infectious tick-borne diseases like alpha-gal syndrome or tick bite anaphylaxis, things like that. So the core of this is basically to mobilize an army of citizen scientists interested in understanding ticks and human health to get some idea of uh, or answer some core questions. And the two
Mm.
kind of core questions we really want to know about are one, what species are where and when are they active? So when are they doing things and when are humans at risk? So the tick species in North Queensland are totally different from the tick species in Sydney, totally different from Melbourne, Tasmania, South Australia, etc., etc. There's some overlap, certainly, but there are lots of species which are unique to some of these areas. And so us understanding what's happening in Sydney is not necessarily going to be the same activity or the same species which may be affecting people in Tassie. So we want a huge number of people across the continent, these citizen scientists, gathering ticks, and this is our tick observatory program. And this is the
Mm.
idea that we'll have citizen scientists which will be gathering ticks at a specific spot continuously once a month for a year or more. And through that, we can actually start to plot the activities of different ticks. When is the tick boom? And when are people most at risk of getting sick? The second part is uh, identifying which ticks are actually attacking humans. And so this is sourcing, getting people that actually get tick bites to collect their tick, record some metadata. So these are things like where they think they got bitten, like as in the geographical area, which park or garden or state forest or their backyard, where they think they got bitten, what location on their body the tick attached to them, collecting the tick itself so that we can actually identify it so that we know which species is bothering humans, and then also taking photos of the tick bite. And so over time, the tick bite can change and getting people to report what sort of signs and symptoms they're experiencing. And through that, especially if they have subsequent infections, we can also then link that back to a tick and a location so that we have some idea, one, what ticks are biting humans, two, what's the damage they're causing, three, some ideas about seasonality and disease progression, and four, if someone actually does get an infection from it, whether they get an infection or a, say, non-infectious disease like alpha-gal syndrome, then we can build some idea of which ticks are driving those disease phenomena.
That's amazing. And why do you think and do you consider it to be an urgent situation now for Australia? What could be the consequences if we fail to progress this, fairly rapidly?
Well, I think Australia is like totally behind the rest of the developed world. I can forgive places uh like Somalia. They don't have a really great public health infrastructure, and it's a very politically complicated and tumultuous place. So the fact they don't have a really good tick surveillance system is not surprising. Australia is a developed country. Australia has an advanced economy. So the fact that the Europeans, the Japanese, the Singaporeans, even the South Americans in many cases are doing better than Australia is, to me, a big joke. Like, this is really serious. People get sick, people suffer horribly. This also, if you want to just think about it from an economic point of view, Australia has broadly, in terms of productivity, a stagnant economy. So we want to increase productivity. And if someone is sick in their bed 5 days out of 7, that's a
Mm.
staggeringly bad thing for the economy. So if you just think of it from a purely economic point of view, lost human productivity is a terrible thing. So From the perspective of economics, we want to make sure productivity is high. We want to make sure people can contribute to the economy and contribute to society as best they can. And if they're stuck in a bed, they can't.
Mm,
In terms of quality of life, Australia is one of the most livable places in the world. It's not livable if you have a tick-borne disease or if you're
mm,
suffering from undiagnosed alpha-gal syndrome and so you're continuously crook because you have no idea what's made you sick.
mm.
So, from a lifestyle perspective, from an economic perspective, and purely from a kind of uh, we're a developed economy, we should be playing with the big boys at the big boy table, doing proper disease surveillance. I mean, the Americans have the CDC. I'm still waiting for an Australian CDC that was promised 2 elections ago. This kind of stuff. So if uh, if the federal or the state governments are not willing to do this stuff, it falls to academics and citizen scientists to pick up the slack. And by doing this, I think that it could immensely help um, Australians, and it can also help policymakers. Because if policymakers know what species to worry about, what diseases are associated with them, when the diseases are likely to spill over into humans, then policy and public health advice can be given to GPs, uh, to local councils, so that we can increase awareness, so that we can actually engage in control of ticks, and so that people can get good diagnoses quickly, so that we can minimize or mitigate any public health challenges associated with ticks and tick-borne diseases.
Mm. Ethically look after Australians ethically
Yeah.
um and so how could
Well, we do it for
everyday
mosquitoes, so why do we not do it for
yeah.
ticks?
Yeah, no, absolutely. And people are suffering, and you wouldn't, if you've ever known someone or experienced a tick-borne disease, you'd never want anyone you love to care about to experience or to go through that journey. It's very traumatic. And so this is really, really important work. So how, we're talking about everyday Australians. I know at the Lyme Disease Association of Australia, we have a culture of volunteering, and we've had volunteers over the last 12 years. And those of us that are here today are standing on the shoulders of those people that got things started. And it's such an important ability and pathway to contribute to a healthy society in the way that you're just talking to, that this is a big gap and people could benefit by it being closed and at least being looked at. And so, how can everyday Australians, whether they're scientists or hikers or pet owners or outdoor workers or parents, get involved and support this national effort called the Tick Science Alliance?
Okay, so I mean, sign up for the email, and then you'll find out everything about it. There's a website that you can go to, which I'm sure there'll be a link in this
Yes.
video description. If you feel particularly keen on getting involved, or you want to do some kind of backyard citizen science, then the Tick Observatory is about to kick off very, very soon. And so we'll be recruiting citizen scientists who will basically be doing monthly tick sampling. It should only take about half an hour in your backyard or in your local forest, something like this, some local area. And the idea is to be able to monitor what tick species are present in your area and then figure out when these species are active and therefore when disease risk might be high. If maybe you don't have that kind of time, you can talk to friends, talk to family who may want to be involved in doing some backyard citizen science. That's a really great thing. If you get a tick bite, that's really, really valuable. It's not good for you, but it's really, really great for this research. So if you can uh, get in contact with uh, the Tick Science Alliance, then we're happy to send out collection tubes so that people can gather the ticks, remove the ticks that are on them, collect them, and then contribute that data to this broader surveillance effort to figure out which ticks are responsible for biting humans in Australia, what diseases might manifest after that, where this is happening, when it's happening, where they're biting people, what the infection progression is like, or the disease pathology from the tick bite, all this sort of stuff. And so if you get a tick bite, please get involved. Or if you want to do some backyard citizen science, it's a great project.
So, Dr. Kwak, that's a really comprehensive overview, and it is exciting to be able to progress an area that's so forgotten and abandoned in Australia, and that could help so many people. So, if you're going to leave the people listening today or in the future with one message today, what key message would you like to offer?
I mean, I would say that in terms of infectious agents in Australia, ticks are some of the most neglected. We really, really are at the very beginning of understanding the diversity of species, how they interact in the ecosystem, and then the diseases that they cause in humans and animals. And so I think this is a really great opportunity for everyday Aussies to contribute to enlightening us about some of the most interesting and also most dangerous organisms that we share Australia with. So I
Mhm.
hope that people get involved or at least might develop a little bit of an interest in these peculiar little creatures, because I think the kind of contributions people can make now are massive and could really help a huge number of people and could help us address what is really a silent and kind of overlooked public health challenge, really
Mm.
threatening a lot of Australians.
Yeah, a tsunami of interested and dedicated Australians to link arms, basically, and to fill a gap that's been affecting so many. So, Dr. Kwak, thank you so much for being here. We're so grateful to have your partnership in this initiative, and we'll look forward to this launching in early 2026. So, thank you very much for your time today.
Looking forward to it.